Hello, this is Dr. Nancy Kuntz. I'm a child neurologist at Lurie Children's Hospital in Chicago at Northwestern Feinberg School of Medicine. I'm here today with some colleagues to discuss clinical considerations for selecting a Duchenne muscular dystrophy therapy.
It's a pleasure to talk with you today, Nancy. I'm Sam McKenzie. I'm a pediatric neuromuscular disease specialist at the University of Rochester.
Hello, good morning. It's great to be with you all. I'm Caitlin Batley. I'm a pediatric neuromuscular neurologist at UT Southwestern in Children's Health in Dallas, Texas.
Wonderful. Well, I'm wondering, Dr. McKenzie, if you might start off. This is a wonderful time to be treating patients with Duchenne in that we have a number of different therapies that are new and being introduced in addition to some of the standard therapy that we've probably talked about in other podcasts. How do you go about determining eligibility for therapy or helping a family select the therapy to begin with to add on to their standard therapy when you encounter a new patient?
Well, you're absolutely right that it's an exciting time to be practicing in the Duchenne space. We have 8 FDA-approved treatments in addition to the mainstay corticosteroid therapy. And it really is a discussion. I think as we get this evidence base that's emerging year to year, where we're better able to compare one drug against others, and we consider things like combination treatments, it really centers around having those conversations on an individual basis with families. But I think to start, and this isn't going to be a surprise to either of you, we really need to focus on what is the actual variant in the DMD gene, because that informs eligibility or ineligibility for some of these treatments. And we can glean from that variant who might be on a course to progress faster or slower. It's not perfect, but we have amassed a lot of data from populations of patients with Duchenne around the world. And sometimes we can sort of predict if a particular variant is associated with a more forgiving or more severe phenotype. And I think that can be helpful at the outset. The other thing, obviously, with variant is exon skipping eligibility. So not all patients are eligible for exon skipping agents. Not all patients are eligible for gene therapy at this point. So we know that there are immune reactions associated with with deletions at the N-terminus of the protein. So we have to consider that when we're thinking about treatment like deladistrogene moxeparvovec.
So, Caitlin, we know that there are some individuals who are eligible for gene therapies and some are eligible for exon skipping, and there's a small group that may be eligible for both. If you encountered someone where they were eligible for both, how would you go about discussing that with the family and making a plan for treatment?
That's an excellent question, and I think one that we're having to encounter on a very frequent basis, which is a wonderful position to be in. And so I think that it starts with a very thorough discussion of all potential opportunities that a family and a patient might have, and kind of going over all of the, potential risks, potential benefits of each and every one. And so it can be a very lengthy conversation and one that really, can put the families at a position where they're having to make some really tough decisions. And I think our role as the medical team is to provide them with, the information that they need to make the specific decision that's best for their families. And so for some families, they might feel that, looking at gene therapy with potential for more significant adverse events might be, a risk that maybe they're not as interested in taking. And so maybe a exon skipping therapy might be more beneficial for them and their families. Or there might be others who say, I don't like the frequency of having to administer these IV exon skipping therapies. And so I would rather go with a gene therapy that is at this time, given just once for now. And so that might seem right for their families. And so I think it really comes down to just having this careful discussion and going over each of these treatments and potential treatments in detail.